Hi class, let's do a basic intro for the skin chapter, and we'll talk about a killer tan. So with a tan, what causes a tan? What you have is that the basal layer of the skin, this is the active growing region. The basal layer of skin, it got this funky looking, looks like a shade tree or almost an octopus. And it's called the melanocyte, kind of a funky looking thing. But what it does is it protects this active growing region like a shade tree. So when you have ultraviolet radiation come down, melanocyte will actually secrete all this pigment into the surrounding cells and kind of branch out and give you that tan color to protect your skin. So there's actually other cancers besides melanoma. There's non-melanoma skin cancers, or they call them keratinocyte cancers or carcinoma. So two common ones, basal and squamous. And basal is real common, especially as you age. So with keratinocyte carcinomas, don't memorize facts and figures, but look at 5.4 million cases diagnosed, 3.3 million people probably had more than one type of skin cancer. And it's been going down over the years, just kind of like education, really, and people just increasing the sunscreen. So decreasing incidence 3% per year for ages 20-29 and 50 and older. Actually, it's gone up because the thing is, as you age, guys, you're wide open to all different types of cancers, especially skin cancer. There's melanoma. Once again, don't memorize these facts and figures here, stats, but I'll let you know what you exactly have to know out of this presentation. But 76,000 expect to be diagnosed. And look, it's only 5% of all skin cancers, but a majority of the death. So this one's really dangerous, called melanoma. So remember, no such thing as a healthy tan. So next time you see somebody with a quote-unquote healthy tan, you're going to look at them and go, ooh, you got some serious ultraviolet radiation skin damage going on there. Best words of advice, wear sunscreen. And then with your skin cancers, there's actinic keratosis. I call it a solar keratosis. Keratosis is thickening of your skin. So local thickening of the skin, but you got some redness around there as well. But it appears your scalp, face, ears, lips, back of your hand, forearm, shoulders, really any part of the body that's frequently exposed to the sun, especially in fair-skinned people. Squamous cell carcinoma, second most common. There it is, right there. And the wart-like growth that kind of crusts over and bleeds. So squamous cell. Then here's the most common, basal cell. Pink growth with a slightly elevated border. And then see the little dent in the middle with crusted over indentation in the center. And the worst one, melanoma. Why is this the worst one? Because it has a chance of spreading. So it spreads. See, the thing is, basal and squamous don't grow all that fast. But melanoma, dangerous stuff, class. So the melanocytes found in epidermis, occurs mostly in adults, most dangerous form of skin cancer. And then invasive melanoma, only 1% of all skin cancer cases, but majority of the deaths. And look at 96,000 new cases of melanoma will be diagnosed in the upcoming year. So what happens with melanoma? Here's your active growing region in your skin down here, basal layer. And it grows and the cells die, full of a protein keratin, flatten out. So remember, this is your stratified squamous epithelium. But what happens is not shown here, but you have a melanocyte that shades this area, protects you. But if you have cancer, what it does is it goes down. And as this cancer goes down, that melanoma goes down. See, got all the blood vessels in here, don't you? See, gets into the blood supply and then, oh, it's spreading. So once again, here's ultraviolet radiation. There's this funky looking melanocyte, but it protects this active growing region. It's trying to protect your skin. That's what it's doing. And by what's called cytokine secretion, it puts these little granules, all right, little melanin granules into the skin to protect you from the ultraviolet radiation. So here's what it looks like in real life. Kind of a funky looking thing, huh? A funky looking cell. And this would be the little pigment right there. Breaks off these little pigments. So a melanosome, that's the organelle found in animal cells in site for synthesis and storage of melanin. So that's the area within the melanocyte. It's called the melanosome. That makes the melanin. And it's a very common light-absorbing pigment found in the animal kingdom. So the melanosomes are responsible for color and photoprotection. So historical perspective. Well, a lot of people actually increase sun exposure lifestyle changes. So as people kind of get a little older here and they're sick of the winter, what? They're going to move south, aren't they? So shifting to a warmer climate. And more ultraviolet radiation is reaching the Earth. The ozone layer is thinning. And the ozone is actually being depleted by chlorofluorocarbons or chlorofluorohydrocarbons even, such as freon. Freon was actually banned years ago, but it's still out there, unfortunately, class. So risk factors. Risk factors, ultraviolet radiation exposure. Look, 80% of the cases. So, especially before age 20. So if you had a severe sunburn in childhood, remember the DNA remembers sun sensitivity. If you're natural blonde or red hair and very fair skin, stay out of the sun. Or using those stupid tanning booths. We'll talk more about those later. Or presence of atypical or numerous moles, greater than 50. Or you have a family history, HX's history. Patients with xeroderma pigmentosum. Talk about that shortly too. And diseases that suppress the immune system. An example of that would be AIDS, for instance, suppresses the immune system. So xeroderma pigmentosum. So look at this little guy right here, right? Very, very, almost allergic to ultraviolet radiation. So what these little kids got to do to go outside is they got to cover every area of their body. So they got to wear almost like a spacesuit, a specialized helmet that blocks ultraviolet radiation, and a hood. And they call it XP. Well, what is it? It's a rare skin disorder, a person highly sensitive to sunlight, and has premature skin aging, prone to developing skin cancers, and XP is caused by hypersensitivity ultraviolet radiation. So it's a result in the DNA repair mechanism in the skin. So nasty disease. And see, the thing is with the kids, if they want to go outside and play, they gotta actually go out at night. There's a camp actually over in New York State, over in Columbia County, Camp Sundown, where they have these folks that have all these, hypersensitivity diseases to ultraviolet radiation. There's other ones as well besides XP. But they have a camp for these kids, which I thought was pretty cool. So if you just go on YouTube and type in Camp Sundown, it's actually pretty cool. All the kids are outside playing soccer and having a good old time. So that's XP. Skin types. All right, porcelain always burns within minutes. All right, how many guys are porcelain? Anybody? Okay, white. That's me. Burns easily. Tan. I burn. Medium white. Any medium whites? Come. Let me say. There we go. Got a few of them out there. Tan's gradual, light tan. Then there's moderate or tan, rarely burns. And then folks with dark brown or black skin, they can burn, but, rarely. So pathogenesis. Change, size, shape, color of a mole. Oozing, bleeding from a mole. Mole's itchy, lumpy, swollen, tender. Or you're kind of like, okay, what the heck is that? Discover a new mole. So an ordinary mole, if you look at an ordinary mole, see, it's like usually perfectly round. It's symmetrical. It's one color, usually like a dark brown. And it's usually fairly small. And you can actually pick up the border. Well, that's your just ordinary mole. But for melanoma, there's this rule, the ABCDEF rule. When I first started kind of teaching about skin cancer, it was actually ABCD. And then it went to E, and now it's a new one, it is F. So asymmetry, meaning that if you draw a line through the middle of that lesion, that skin lesion, one side will not match the other. Borders all over the place, border irregularity. It's got different colors. You might see red, you might see almost like a tan, you might see even black. Diameter, bigger than a pencil eraser. E, it evolves, it changes. And F, newest one, it's funny looking. So you look at these, all right, here's just your, A, B, C, D, E's of melanoma. So here's just normal, all right, these are benign. So symmetrical, one side matches the other. Melanoma, it's asymmetrical, huh? Border, nice even borders. These borders are all over the place. Color, usually one color, multiple colors. Diameter is smaller than a pencil eraser. So it's kind of hard to tell with a slide. And then evolving, here's your ordinary mole, and it changes. It gets a lot darker, and then you have another one next to it. Or you look at this one. All right, A, B, C, D. Can't really do the E and F on that, but I'd say the F's kind of funny looking, isn't it? All right, put this one through. Let's see, asymmetry. I'll draw a line through the middle. One side match the other? Nope. Border all over the place? Yep. Does it have different colors? Yep. And then diameter, you can't tell, and you don't know if it's evolving, but it probably is, but it is funny looking. There's another one. You go through the A, B, C, D's. Borders all over the place. You got different colors. One side doesn't match the other. And it's funny looking. There's one between the toe, right there. And then, here's another one. Not looking too good, huh? And then, ooh, that's a nasty looking one. Ooh, that's even worse looking. It's got all kinds of colors, isn't it? And then melanomas can come from pre-existing moles that appear in the upper back, lower legs, head, neck. So you look at this, something going on here. I got some darkness in the skin in here, and there's some kind of outlying border here. See that? And then that person probably ignored it. And you get something funky like that. All right, that's nasty. That's very, very dangerous. That lesion is dangerous. This newest thing is called the ugly duckling rule for picking out melanoma. What they actually did is they took some just regular John Q. Public people, and they split the group in two. And half of them, they taught them the A, B, C, D, E rule. The other group, they just said, just tell me if it's the ugly duckling rule. Just see if it's funky looking. That's all. Is it funny looking? So with the ugly duckling rule, there it is. So look at that guy. He's not looking too good. There it is. Asymmetry, border, color, diameter, bigger than 6 millimeters or bigger than pencil eraser. Evolve, and it changes. Oh, it's kind of funny looking. You look at this, the ugly duckling case. Well, let me see. Anyone? Anybody? Anyone? Anybody? Anyone? There it is. How about this? Anybody? Anyone? Some regular skin lesions right there. That one not looking too good, huh? How about here? Anybody? Anything? Some regular moles right there. Ooh, that one's not looking too good, huh? Anybody? Pick them out on this patient. Ready? What do you think? Come on. Guys are getting into medicine. This one's questionable. Well, this one's definitely questionable, huh? And then benign, malignant. Benign, malignant. There's another one. Benign, malignant. So once again, remember the melanoma, what it's going to do is it's going to go through the epidermis, down into the dermis, and once it hits the blood vessels, then it's going to spread all over the place. So DX is diagnosis. Diagnosis, full thickness wide biopsy. BX is a biopsy. And also if the lymph nodes are involved, they'll do a biopsy of the lymph nodes. Then there's this Clark level of melanoma classification. And don't really knock yourself out with this, but here, let me show you. So here's level 1, which is high in epidermis. And then obviously as it goes to level 5, it starts going deeper, starts spreading out sideways. So it's going more lateral, it's heading down. So there's Clark level 5, which is right down through the whole epidermis and the dermis. We'll learn about papillary and reticular parts later on, and also into the subcutaneous layer. So that's not good. This one's confined in the epidermis, easy to treat. So is this one. These guys a little bit harder. This one's going to be real hard to treat. So thickness is the most important prognostic factor. Guys know what METs are? All right. MET stands for metastasis, meaning spreading. It spreads. So as I showed you in that previous slide, if that's really thick, oh boy, it's going to spread throughout the body. So staging. There's stages 1, 2, 3, 4, and recurrent. Stage 1. Stage 1 cancer, or stage 1 melanoma, is confined in the epidermis, upper dermis. The lymph nodes aren't involved, and really not that thick. All right, not a really big tumor, not that thick. Stage 2, now they're going to get a little bit thicker and a little bit bigger. Spread down to the dermis. The lymph nodes aren't involved. That's good news. But, see, getting a little bit bigger there. Stage 3. Well, getting bigger. Now it's going to the lymph nodes. Body tissue below the skin. You might get a small little tumor next to it, satellite tumor, and that's not good when the lymph nodes are involved. That's not good. Stage 4. Stage 4 is not good. Spread to other organs, and the lymph nodes are involved, distant lymph nodes. And then recurrent recurs after treatment or reoccurs on the original site or somewhere else in the body. So treatment. Well, treatment for non-melanoma skin cancers, you can treat it right there in the doctor's office. Surgical excision, electrodesiccation, so they'll actually burn it and then scrape it out, or they'll go through with the liquid nitrogen. It's like a little blue spray can, and they spray this extremely cold liquid nitrogen, and it freezes the skin lesion. So for melanoma, well, not as easy, class. Surgery, lymph node biopsy, make sure lymph nodes aren't involved. Immunotherapy, trying to get the body just to kind of take over and fight the melanoma. And chemotherapy, and you might need radiation therapy depending on what stage that melanoma is at. Prognosis, overall 5-year survival rate, not bad, 92%. That's not too bad. Meaning you get diagnosed with early stages of melanoma, you have a 92% chance you're going to be around in 5 years. That's good news. So stage 1 and 2, look, it's even higher, 98% stays localized. Then as it starts to spread, your survival rate starts to drop. Stage 3, 64%. Look at stage 4, especially spread throughout the body, only 23%. So overall, 92%. But remember, catch it early. That's the same with all cancers. Catch it early. Once again, don't memorize this section here. The thing really wants you to memorize, make sure you know the A, B, C, D, E, Fs. Make sure you know that rule. So make sure you know those, okay? All right. And then real life cases. So at real life cases, well, the thing is that your instructor, man, I had a squamous cell taken off my back. A bunch of basal cells that get frozen. No melanoma. A friend of mine that her dad worked out in construction all his life ended up getting melanoma, but actually he survived it. I had one of my students, young lady, probably 19, 20 years old, but would go in those stupid tanning booths, which are really dangerous, and she ended up getting a bunch of basal cell carcinomas from a tanning booth. So just be careful out there in the sun. All right, protect yourself, protect your skin. Prevention. Remember, next time you go to the doctor, don't forget, get the skin checked out, all right? Limit ultraviolet radiation exposure. So hide in the basement, wear protective clothing, and wear sunscreen. Avoid the sun between 10 and 4. So, stay in your cellar with the shades down. Cover as much skin as possible. Wear sunglasses to protect the skin around your eyes. And all the sunglasses are, all 100% UV blocking. But exposure to ultraviolet radiation will cause clouding of the lens of the eyes, called a cataract. So get yourself a good pair of sunglasses, and when you do, make sure they're 100% UV blocking. Most of them are. And then with the sunscreen, the higher the better. 15 or better. If you get 50, get 50. But especially for the parents, all right, make sure you lube those kids up really good. My kids are very fair skinned. They're not kids anymore, but, you know, I still like to see them more or less not tanned, and they know they're not supposed to be tanned because they'll be at risk for skin cancer. So remember, protect the children. You can get burned through loose weave clothes, wet clothes. Watch your head. Look, even on a cloudy day, some of the harmful rays can get through the clouds. Left arm, driving around with your left arm hanging out the car window, right? Careful of that. And then for you nudists in the class, make sure you wear hypoallergenic sunscreens, right? Oh boy. A friend of mine used to work at Eastover Resort, and they would have the nudist colony would come in for like a week. It's like, ew. It's kind of people you don't want to see naked. Ew. Right? How the hell are you going to play tennis with somebody naked? It's like, nah, I don't think so. Right? Ew. And then, here we go. Select the cancer, the tanning bed, basal, squamous, and melanoma. Right, so tanning beds. Carcinogenic. Humans don't go on these things. I know some gyms, I know that Planet Fitness has it. And I think there's another one, Retro Fitness have these tanning booths / tanning beds. Don't use them. Please don't. If they're not probably carcinogenic, they're carcinogenic. Don't belong in the gym. They're not safer. I remember getting in an argument with a student. Well, you know, my mother owns a tanning booth salon, and no, it's a healthy kind of ultraviolet radiation, so they don't really get cancer from it. Class, there isn't a healthy ultraviolet radiation. There isn't one. All right, there isn't one. It's ultraviolet what? Radiation! So it increases cancer risk. Look at this, 20 minutes in one of those nuclear booths, tanning booths, 8 hours in the sun. 2.5 times more likely to develop squamous cell than those who don't use them. 1.5 times more likely to get basal cell carcinoma. So you got, yep, UVA, UVB. UVB, burning, tanning, skin cancer, ultraviolet radiation. UVA is the aging, wrinkling, brown spot, ultraviolet radiation. Let's see, guys. I don't see a healthy ultraviolet radiation there, do you? Anybody? Anyone? Anybody? No. So, look at UVA. Penetrates skin deeper. Suppresses the enzyme repair mechanism. So, natural mutations are uncorrected. So, look at the skin cancer rate. 50 to 400 times higher using those stupid tanning booths. All right, so UVA levels in tanning booths 15 times stronger than the sun. So say, for instance, you don't listen to me and you go in a tanning booth. All right, you'll go for 15, 20 minutes. And then it's a nice sunny day. You're going to go out in your driveway, wash your car. So now when you're washing your car, the sunlight from the sun, well, you don't have that enzyme repair mechanism because the tanning booth suppressed it. So it'll open you wide open for skin cancer. Indoor tanning can increase a fair skin's individual risk of developing cancer by 55%. What were you thinking? Remember this lady? She would go in a tanning booth. I don't remember this mom. Now you look at this little girl. This little girl, let's see, she got red hair and very fair skin. So she would go in a stupid tanning booth and bring the kid in there with her. It's like, what are you thinking? Boy, you gotta pull her up on the internet. Oh my God, her skin's like leather. So if you want some color to your skin, I'll get sprayed. All right, fake it, don't bake it. So just get sprayed so you look orange. All right, it looks like definitely Donald Trump. He looks orange. I'm not gonna go into politics with you, but he definitely gets sprayed. He looks like Oompa Loompa. Yeah, orange. So put sunscreen only where you don't want to get skin cancer. American Cancer Society, I didn't make this up. Slip on a shirt, slop on the old sunscreen, right? Try to do it a couple hours, half hour before you go out. And then every 3 hours, at least 3 hours afterwards, put a hat on too. And then, get the word out there. Remember, part of your job getting into healthcare is what? Patient education. Educating the public as well, your loved ones. Wear sunscreen. Take precautions. Wear sunscreen. Make sure you wear sunscreen. Okay, just wear sunscreen. Otherwise, look what it does to your skin. Look at this. Increased wrinkling of the skin. It's just, no. So if you want to keep your skin young as you age, 1, stay out of the sun. 2, don't smoke. 3, make sure you have a halfway decent diet. Make sure you have enough water and eat your colors. All right, your colors, colored fruits and vegetables. Otherwise, you're going to get something funky like that, and it's going to freak you right out. All right, thank you.